Uh uh. Microphone check. 1 2 1 2. This is the Blaze the Line podcast. I am your host, Blaze the Line, Blaze the Machine, Blaze all those, yes. All those. Thank you all for tuning in. This month's theme is doctors. Yes. So for the whole month of October, we are highlighting, we are featuring, we are showcasing doctors. We're giving them a platform, one of many platforms, to speak about health, and not just health that you see on social media or health you see on TV, or health that your family might have told you, but let's hear it from the doctor's mouth, right? Let's really get into health. So I really wanted to focus on health, especially in the craziness of this
Yeah.
current season. Yes, yes. For those who are loving the movement, um, I really appreciate it. And what you can do for me is hit that like button, right? Right there on this episode. Click the like button. Also, as I'm getting notifications in the midst, make sure that you subscribe on YouTube to the Blaze the Lion podcast. Right? We're also streaming Apple Podcasts, Google Podcasts, Spotify, and all those major platforms as well. So feel free to follow us there and subscribe as well. Leave reviews, leave comments, all that. All right. I love the interaction. I also would like you to leave comments and ask questions right here live. All right, right here live. This is a platform. This is a forum. We're just talking. We're just chopping it up. All right, speaking about health. So, also, as I'm still getting notifications, you can give me your money. All right, right here at the bottom, we have 3 tiers, 333. All right, for as little as 99 cents, all the way to $5, and all the way up to $10. All right, you can be a monthly contributor to the podcast, and you get Blaze the Line podcast apparel. You get these cool T-shirts that I've been posting that you've been seeing. All right, you also get access to different courses and webinars that I've been saying that for a while. I know, but it's coming. It's coming. All right. I'm just getting all the information. I'm getting all the education, learning and growing along this journey. And then please believe I will be bringing you guys more seminars, all right, more things to help you all, help us together, all right, to not only change lives, but to walk in our purpose. Indeed. So tonight's guest, hmm, so you gotta let it breathe a little bit. You gotta let the air catch you. Tonight's guest is someone that I've known for. Hmm, I mean, I don't want to give away the ages and
Don't do it.
no, don't do it. Okay. I've known her for a little bit,
Yeah, a little bit, a little
a
bit.
little bit, a little bit, a little bit, for a few decades. All right.
It's
But
not
I,
more than 10.
huh? Nah, just a couple, just a couple decades. Even though we all look like we're in our mid 20s, you know what I'm saying? See,
I'll take it.
yeah, man, black don't crack. We out here. For this woman, I've seen her, not everything, but I've seen from afar some of the ups and downs. I've seen the growth. I've seen the maturity. I've seen from cheerleading and doing things in high school to finding her purpose, to walking in it, man, to really impacting this world. Um, so for tonight, I would like to showcase one of my Stranahan alumni.
Go
Hey,
Dragons.
hey, that's the high school. None other than the guest that you've been waiting for. Yes, you. Dr. Venessa Walker. Welcome to the pod.
Thank you so much for having me. Thank you. I'm excited to be here. As we were just saying, it has been plus years. And it's just a great blessing to see us walking in our purpose. So grateful to be here.
Yes, yes. Awesome, awesome. So I gave my brief. Wait, what is this? We are young and sexy. Yeah, thank you. You know, we try. We try. So I gave my brief introduction of you. So for the listeners, for the audience, share a little bit about yourself.
So, as shared before, Dr. Venessa Walker, I'm a chiropractic physician here in Miramar, Florida. Ecstatic and absolutely love what I get to do, and yeah, so that's the focus. We are people driven, and our mission in our office is taking care of the whole totality of our patients.
Hmm. I love it. Shout out to Sasha in the chat. Shout out to Dr. Joy Smith Jones in the chat. Checking in, checking in. Yes. So, being a chiropractor,
Yes,
how long have you been a chiropractor?
I think I'm at 13 years now. At
That
13
ain't
years
true.
of physician. I know. 13 years of physician. But I started chiropractic as a CA. So 19 years, 17 years in the field. Yeah.
Wow.
Yeah. So I
Wow.
started as the chiropractic assistant in a physician's office. And so yeah, about 19 years in the field.
Wow. Wow. All this time I thought you were in your mid-20s though. So
I,
I'm trying to do the
it's
math.
just the look. It's just the look. That math is
Yeah, it's
not.
not adding up. I love it. I love it. I love it. So being a CA, well, first off,
Mhm.
Stranahan was a medical magnet school,
Yeah.
right?
Yes.
So where did, or when rather, did your passion for the medical field begin?
So
Was
I
that?
always had the desire of helping people. My mom's a registered nurse, and just seeing her walking her, what she was doing as a healthcare provider, I had that desire. She being a nurse, I wanted to be a doctor. I heard that in order to be a doctor, you need to go to the medical magnet program. So I went to Stranahan High School. Matriculated through the program, and then went to University of South Florida, where I attained a biomedical science degree. And that's when I found out about chiropractic. Prior to that, I had no clue. So, if I tell you a quick short story, when I was doing my first semester of University of South Florida, we had a class called University Experience. And in that class, they wanted you to find someone who was in the profession that you desired to be in. And my desire was to be in sports, be a sports physician. When I was
Uh-huh.
in high school, anything that was tied to sports that I could do, I was in it, right? So I wanted to be a sports physician. So in those days, right, it just aged a little bit. We had the yellow book, the telephone book. So I went through the telephone book. I was 17 at the time. Went through the telephone book and found a sports physician. So I shadowed him for the afternoon. He answered all the questions that I needed. He said he was a chiropractor, and I was like, okay, whatever that is, cool. I didn't know what a chiropractor was, but he looks like he liked what he was doing. So, anyways, I left his office, and the next day I sent him a thank you note in the mail, gave him my information, and he called and offered me a job as a CA in his office. So that was my introduction to chiropractic.
Oh wow.
Yeah,
Oh wow. Look at
yeah,
that.
that was
So
my introduction.
two things about that. One, you said the yellow pages. See, I wasn't gonna let that slide. That was before. Yo, now you can find doctors on Instagram. Not saying that
Oh,
I
okay,
find doctors on Instagram, but I'm just
but
saying,
you
yeah,
can't.
like everything is there, right? At your fingertips. So shout out to how it used to be, how we actually had to manually like search,
Yes.
like actually work.
Mhm.
I remember to advertise business, it was actual business cards and putting flyers on a card. I mean, they still kind of do that,
Mhm.
but that was like the main way. There was no tagging businesses or all that. So
Tag or redirection and so on and so forth. Now you feel like everybody's listening to what you say. because as soon as you hear ad about it. But yeah, back in the days it was a telephone book.
Mm-hmm. Indeed, indeed. And speak about getting that offer. Um, was that a just a good vibe? So as a student, I'm sure that it's a risk
Yeah.
to hire somebody. So how was that? Was that shocking?
I didn't expect there to be a job offer, but as I mentor now and have young ladies that I do mentor, I always say to them, in whatever space you go and you want to put your best foot forward, because I was on an interview and I didn't know that, right? And on the flip side, when your elder, your guardian, your mom, your dad say, tell them thank you. If it's a thank you note, if it's writing a letter, however that may be, if it's an email now, you just make sure you thank people for their time. So when he offered the job, it was my first semester. My parents had said to me that just kind of, I was 17, going off to college, 17 years old. They didn't want to let go of me to go to college so far, 4 hours away. But they did. So my mom and my dad had said to me at the time, your first semester, just kind of see how that is, no working. So Dr. Jones, who's a doctor who hired me or offered me the position, he was like, I mean, you're not like working out where you're not under a covering, or you're out late at night. They probably will say okay to this. So I called home, asked if I could have take the position on, and they said yes. So I went for it, and I stayed with Dr. Jones for the entirety of my undergrad career.
Mm. Wow, look at that. So experience, like hands on.
Yes, right on, right through the door,
Best teacher right there.
right through the door. Yeah,
Mm.
absolutely, right through the door, was hands on. And I didn't decide chiropractic right away. When I was working in his office, I was still I just loved what I was doing. I wanted to see athletes. We were doing that. We were seeing the athletes from University of South Florida football team. Like we were seeing athlete. And then I would see other things that came through the office. One time we had a older gentleman who came into our office, that was like crawling into the office because he had sciatic pain.
Mm-hmm.
And a few days later he was walking out the office. So I was like, this is just, whatever he's doing in that room, which at the time was an adjustment. I was like, this is wild. We had a child that came in before where mom was complaining about bedwetting, and just kind of seeing different things transpire in the office. And I loved what I was doing. I loved the staff that was there because we were literally like a family. I still talk to some of them, or
Mm.
still in relationship with a few of them. But it was just a great atmosphere. It wasn't this heavy burden. Like, even if someone was coming in with an ailment, there was some resolution that was to come. It was a good place to be. So I did my 4 years with Dr. Jones, and I was medical school. I came to the University of South Florida to get a biomedical science degree, and I was going to medical school. So my senior year, I think my junior senior year of the University of South Florida, I got a scholarship to go to the University of Alabama in order to do a minority program where they would help us with our MCAT studies and things of that nature. I had the opportunity to shadow every doctor in whatever field it may be that I wanted to. So I did emergency room medicine. I helped with a kidney transplant with a urologist.
Mm.
I shadowed the orthopedic surgeon, which I figured that was my best route into
Mm-hmm.
sports medicine. And when I shadowed him, he was suturing a wound on somebody's leg. And I was like, I don't know if this is it. In conversation, in hindsight, I thought, that conversation wasn't the best conversation for him to have with me. But he said to me, if you wanted to be a wife and a mother, I don't think orthopedic surgery is for you. Well, I'm not either those currently. So I had vast amount of time if I wanted to practice, orthopedic surgeon. But I came back home and said to Dr. Jones, I think I like what I've been doing here. And he was like, well, apply to chiropractic school. So me being Venessa, applied to every single chiropractic school. And when I did that, I just wanted to stay closer to home. After shadowing a few other schools, I decided on Palmer College of Florida in Port Orange.
Mm. Hmm. Okay. So now bring us up to speed now.
Yes.
What you're currently doing now
Yes.
is that, and then what you're doing now in comparison to what you saw as a student, as a CA, is it what you expected or is it vastly different?
It is what I expected times 10, probably.
Okay.
Yeah, times 10. I am grateful to Dr. Jones and just that experience and just, being open to something different, being open to the unknown. I always say chiropractic chose me. I didn't choose chiropractic, and I'm grateful that it did. But as you say, now in our office, we have the same mission, we have the same focus. Our patient is the mission. I see Dr. Joy, one of my classmates from Palmer, Florida. Yes, representing, I can take that. Yeah, so patient is the mission, and I
Yeah.
always say in the office that we're not bigger than the mission. None of us, not the doctor, not the CA. And I think that's the reason why, because we all just kind of come together and make it happen. Our main focus is our patient, making sure that they're getting the best care that we can deliver. And if we need to do something outside of our scope, we assist with those process. But the patient is the mission. So when we're all focused on that mission of making sure that we're focused on that whole entirety of the patient, we all get to win. So I do have a working family. Like, we look out for each other. We make sure that we're there for each other. I tell anybody who comes through the office that, looking for employment, we just got to like each other. We got to want to be around each other. So we make sure that our patient is the mission through the scope of chiropractic.
Yeah. Yeah. Hmm. All right. So share with us the myths. Are there any things that
I got
that yeah, tell me. Share
So
with
here's one myth. I cannot crack your spine. I can't. Listen, I've been adjusting for plenty of times. If you get an adjustment, I'm not gonna break your neck. I've been adjusting for years, right? So that's one of the myths, right? So if you go to a chiropractor, are they going to, the cracking sound, is that a sound that is really breaking your neck? No. No, that's not happening. We are highly skilled in what we do, and it's a specific technique that has taken years of training for us to be able to do what we're doing. So that's why we don't recommend you doing it at home, right? So what we took years of training is not something that you want to just go and, twist neck here and there all the time. Do that at your own risk, and sometimes your risk might not be the best thing for you. So that's a
Mhm.
myth. Another myth is, once I go to the chiropractor, I have to go for the rest of my life, right? And why that is one part where I say a myth is that it's kind of like if you start to take a supplementation and you see that change in your body with that supplementation, why do you want to stop, right? So it may not be this ongoing every day, I'm going to the chiropractor every visit, but you want to make sure that you're maintaining what we have worked really hard for you to get towards. So those are a couple myths. Another myth is, you know, when I walk in rooms, I hear, "Oh my God, you're a chiropractor? I've never seen one, a female, two, a black female chiropractor." And I want to say, we're out here, right? And it's not a size of, oh, this stature that allow for adjustments to happen. It's our skill, it's our technique that allows that to happen.
Mhm. Hmm. Yeah. As you were saying that, do you remember your first time doing an adjustment? And was that scary? Was that intimidating? Did they have
You
volunteers or was it a real patient?
I'm gonna say that my first adjustment probably was in clinic, and it wasn't scary because we practiced a lot on using tools, right? So we practiced a lot just using our hands, getting our speed. As I shared before, it is a technique. It's a technique that we have to work. vigorously on. So there was a lot of practice that got us to that space. So no, it wasn't scary. Yeah, I can't say scary was to use towards that. So no.
Okay. As a personal trainer, every now and then, I get
Find
people
some.
and yeah, they come to my class and they have pain and they come to me, hey, what should I do? And the first thing I say is, what are you eating?
Yes.
And then they walk away because they don't want to face that. And I'm like, oh, okay, never mind. But sometimes they'll say, hey, really quick, can you crack my back so I can? And I'm like, nah. I can crack my own back. I know how to do that. But I'm not gonna be held liable for
I was gonna say you don't want those problems.
mm-mm,
Yeah. Yeah. So I
no
don't
parts of that.
at all. As I said before, it's that one time, and it's truly is a technique. I know now with all this social media, and you might hear, yes, you should do this in order to, well, I gotta call that crack because it's not an adjustment. Adjustment is specific. What we do is a specific technique to the area of subluxation. So just a general overall, like, hey, I want to hear the sound and I feel a relief. That's not the specific adjustment that we do as chiropractors. We are looking for the misalignment, where that subluxation is, where that vertebrae is out of place, and we are targeting that specific vertebrae to stimulate the nervous system in that area. So most of the time people associate pain and discomfort to, hey, let me go and see the chiropractor. But what we're allowing the body to do is to do what it knows to do best, to heal
Mhm.
itself, right? So we're just the vessel that allow for that system to happen. I say to my patients all the time, like, I'm just the vessel. So I give you a prime example. If you cut your hand today, right? Will it not heal, or will it heal?
Yeah,
Yeah,
absolutely.
absolutely it will. But if you decide that I want to put a band-aid on it, I might clean the area, I might put some neosporin on it, I may do some additional things. And if it's natural herb, I might rub something on it to decrease that inflammation. I might put whatever that may be.
Some white rum.
Hey, listen.
Some Jamaican white rum.
But the body is going to heal itself. The body is always looking to be in homeostasis. The body is always looking to be balanced. So that's why we know when dis-ease is taking place. So because you know that the body is going to naturally try to heal itself, it's going to do that. So as chiropractors, we look for, or a couple of reasons why a subluxation may come about is we look for thoughts, traumas, and toxins. And in 2021, I say also technology is a part of those T's. So those three tiers. So thoughts, right? We get emotions that change our, stress, situations that change our body makeup. So then we have that releases hormones that change those differences. And we have where
Mm.
it's released into our system. So now ligaments, tendons, vertebrae start to move, misalignments start to happen. Then you have toxins, what we put in our system or the environment of our system that allow for that change to happen also. And then trauma, most of the times we associate trauma to, our chiropractors, the motor vehicle accident, the sport injury, the low
Mhm.
back pain, the sciatica. I need to go see the chiropractor. I have neck pain. But that's just one tier. But our main focus is to making sure that we are allowing through chiropractic adjustments the decrease of subluxation, which is a misalignment um, of the vertebrae. And that can happen from neonate to geriatric, right? So we see the baby out of the womb in our office, and we also see the wise who's like, listen, right? So we see through from A to B. I mean, from A to Z. I was trying to read that question.
17 years. Look at that.
And it is an investment. And as we talk about investment, we hear the statement, my health, your health is your wealth. And sometimes we loosely use that statement, but
Mm.
truly when you invest in your one body, right? This is one thing you can't replace. You know, there's a lot of things in life that we can replace, but you can't replace your body. You know, when it starts to be at dis-ease, when we don't find the root cause of what's happening and we have this breakdown that's happening in our system, then that wealth don't really come along. You're not able to, and wealth can be so simple. You know, it could be the patient that comes through my office and say that because of my repetitive adjustments or me going through a care plan, I am able to, you know, sleep at night or sleep better at night, or I don't have as many migraines, right? So for us, where, you know, we don't get headaches on a consistent basis, that's not a big deal to us. But for someone who their livelihood, their lifestyle is being changed, their way of living is being affected, that's a big deal.
Yeah. Wow. Absolutely. Absolutely. See, it's a vibe, right? It's a vibe because we are on Doctor 3 of this month's theme, right? And every single doctor, by chance, by coincidence, by spiritual intuition, every doctor on this show has said the same thing, that the body is designed to heal itself,
It is.
right? And getting to the root cause. And unfortunately, not to bash anybody, because that's not what I'm here
Yeah.
for. But in this day and age, unfortunately, there are many doctors and healthcare professionals who don't speak about that.
Yeah.
They cover that. They're like, no, let me just give them some medication, or let me just keep them as a patient. You know what I mean? And it's like the
Yeah.
body is designed to heal itself, right?
Absolutely. And I believe that's also a trained position. So, you know, I'm very transparent in the sense that, you know, if I'm in a position where I've been in some type of trauma and I need to see the medical doctor, take me to the medical doctor. Don't take me to the chiropractor because we don't know what to do with you, right? And that's the transparency. So there is some stance. You know, if I have a patient who comes into my office and say that they have blank list of medication that they're on, I'm not telling them to get off their medication, right? And hey, let's go do something that's one out of the scope of two. But what we can do is work in cohesiveness with the physician to wean them off, or having that patient take the stance to say that, you know what, I'm doing better because I'm now making some lifestyle changes with my chiropractor in order to get off that. But we need to also know when we're in an emergent state, because most of the times we put ourselves there. But if we are in an emergent state and we need to take care of that, take care of that so that we can get to where the body can now balance out, and we get back into the space of homeostasis where the body is balanced, because it's not truly. So when you're taking medication is telling the body what to do, compared to in a holistic portion, we're the body is telling this holistic medicine, herbs, so on and so forth, what to do.
Mm, indeed, indeed. Thinking about what you're saying, um, what cases have you gotten, or share some of your
Mhm.
extreme cases where maybe you had to tell a patient, you may have to leave. Like, this is just a little bit too intense. Has there any, has there ever been anything just too crazy?
So I have um so I don't think it was a matter of leave, but co-care, right? So for them to see their OBGYN and also a fertility. Was a young lady that we're treating in the office who desired to be pregnant. She did have a misalignment of her pelvis, but that was a co-care because there's other things typically sometimes that are going on that needs, because my focus is your misalignment, right?
Hmm.
We align that vertebrae, we align the system, and the system does what it needs to do, right? So for her instant, we needed a co-care with the OB and also fertility specialist in order to get her to a space that she needed to be.
Mm, okay,
Yeah.
okay.
And natural fertility specialist. So like Dr. Zake in for instance. Yeah.
Shout out. She was on episode 42.
Yeah. So in that space, that was the co-care. Yeah, and I've had patients, because we do see trauma patients in our office. I've had patients who's come into my office and I'm like, no, that's a fracture. You need to see the orthopedic surgeon.
Right,
Yeah,
right,
so there
right.
are definitely instances that has come to our office where no, that's out of the, there is a code that can happen, but for that particular, for example, fracture, he needed surgery.
Got you, got you, got you. So I like to present this platform also as accountability, right? And people who follow, people who are tuned in, most times want to know, well, you're telling me all this stuff,
Hmm.
but do you do it? Do you
Okay.
incorporate it in your life?
Yes, I do.
So,
Okay.
two questions.
Okay. Tell me the question.
uh, do you use the services that you also provide, right? Is the chiropractic care part of your regimen? And then the second question is chiropractic care for everybody?
Okay, so first answer, yes, I am blessed. As I say, at my office, we have an amazing team. Dr. Amakar and Dr. Brown is in my office, so I have the capacity to get adjusted right in my facility. So how can I not do that? Right. So yes, I get to practice what I preach in that sense. And we all in our office have this, we're there. So and we all get adjusted. So that portion, yes. And is chiropractic care for everyone? My short answer, absolutely. Right. So I always say, when was the last time you saw your spine? Okay. So because you haven't, you want to make sure that you're tuning up that system. So what happens? So someone might say, why does a baby need to be adjusted? Right. So a baby in a mom's womb have been in a fetal position the entirety of the time. Right. We want to make sure that we're stimulating that nervous system. And then sometimes people are frightened by the fact of, how do you adjust the baby? Are you like twisting their neck like you do so others? No, they're totally different techniques, and that's why I say you don't do these things at home. You want to make sure that you're in the hand of an expert, someone who's trained to do this. So there's totally different techniques that happen with a newborn, that may change with an infant, that may change with someone who is in dire pain. So we have different adjusting techniques, adjusting beds that allow to facilitate that. But I say, yes, you want to get your spine aligned. And then in our office, we use a thermal scan. So we're scanning your spine to see where there is an increase of heat compared to, which is registering as a dis-ease, dysfunction, something is going off, that air is firing too much, what is happening there. And we're looking to, as we say before, bring the body back in a line of homeostasis, the dis-ease, the root cause. Sometimes we have pain in our system or pain in some capacity, and we're like, oh yeah, I'll just take this or I'll take whatever to decrease the pain. But that's the body way of saying something wrong, something's
Facts.
going on, you know and we may have these skills aligned of physicians that we've been through training and so on and so forth. But above all of that, we are, everyone individually are the greatest physician of their body. And why that is because you know what's happening with your body. You're with you all the time, right? So pain is not a lifestyle. Like pain is not a thing. It's
Hmm.
not a lifestyle. Like that shouldn't
Hmm.
be the thing. You shouldn't have to,
I
achingly get
felt that.
you shouldn't have to hold your back to get up all the time. You shouldn't have to, this time it's hurting. Those are indicator that something's going on.
Yeah.
In sharing at times with patient, I always say, when do you know cancer is happening? When do you know a heart attack is coming? You don't, because it's probably been brewing for a long period of time.
Yeah.
And then it shows up as a red flag, just alarming in your system. So know that pain. Yes, pain is not a lifestyle. Like that's not a thing. It's not a thing that you should say, you know what? Well, today I have a headache and tomorrow I have a headache. It's not a lifestyle.
Yeah. Yeah. Truth is, though, so many people feel like they're stuck
And
and they don't get to the root cause. So they're like, all right, I'll just pop pills every day, or I just know that I can't go to the gym anymore because I have this pain. And it's like, don't you want to get to the root? Don't you want to find out if maybe you don't have to always have pain?
yes.
And some people, I see that all the time where in training, sometimes I'll get people to do something and they're like, I haven't done this movement since I was in high school. Oh my, and I was like, well, because you change how you're eating, you,
Yes.
as you said, thoughts, you
Hmm.
change how you were thinking. All these things actually work, right? And your body's beginning to move and feel different and act different.
Yeah.
So
Yeah. Yeah.
pain is not a lifestyle.
It is not a lifestyle. It's
I
not.
wonder if that's on a shirt or something. If not, I'm gonna take that.
You're gonna put it on a shirt.
Man.
You know what I also believe with our society, with our community, with just the way of life is this microwave system, right? So
Hmm.
we want it to go away quickly. If it hurts today, let it disappear tomorrow. How can I mask it, right? So when we're taking medication, as I shared before, opioids, drugs, whatever that is, we are the medication is telling the body what to do, or the medication is, yeah, telling the body what to do. So in turn, all it's doing is suppressing what is happening in that moment to allow the body to heal itself. That's it.
Hmm.
To
Yeah.
allow the body to heal itself. If you go into the emergency room and they're like, we have to put him or her into a induced coma to allow the body to heal itself. If we're taking medication, it's a mask to say we're allowing the body to heal itself. Some things do go for control, controlling system. Maybe it's the blood pressure, maybe it's the high blood pressure, maybe it's the diabetes, maybe it's things of those. But also know that those things are preventative. So what happens is that we have an insurance model that allow for reactive care. If something happened, you go to the doctor, not a preventive care where let's make sure we prevent things from happening, right?
Yeah.
So that's our model. I will share that again. You should be seeing a chiropractor. You should get your spine evaluated. If you had So tell me, if you had a dream car, what would that be?
Porsche 911,
Okay, so Porsche
black with the red interior.
black with the red interior. Tell me, tell me, would you go if you get your car now, your dream car, and at the dealership they say every year I need to make sure that you do a tune up on your car. Would you go to skipping years on your Porsche 911?
Hell no. I'll be
Exactly.
there early. Let's go.
So we want to make sure that we're maintaining the integrity of our spine, maintaining the integrity of our system. Some of us have never gotten our spine checked or tuned up, or anything to make sure that the oil is running properly, to make sure that we are aligned, and even be so we wouldn't have our luxury car. We got one body. We wouldn't have our luxury car just on the road, without maintenance, without rotating the tires, without
Hmm.
making sure that it's in full alignment.
Yeah.
Yeah.
Quick side note. Some of y'all waiting on God to bless you with a Porsche, but you can't even maintain a Honda Civic. Just saying.
And that's
Mm,
it. And that's it. We got to make sure that we're taking care of our body. We got to make sure that we're taking care of our system.
yeah, absolutely. Hmm. You got my wheels turning now. Might be time for me to go back to a chiropractor to really see. I go. Truth be told, all right. Just
Truth be told, here it is.
truth be told, I have one of my clients is a chiropractor.
Okay.
Shout out to Prince. And the only time she sees me is when I have pain.
Mm.
And I'm like, hey, I got to teach class tomorrow morning. And my back pain is at 8 right now. Hey, can you? And I know, of course, of course she'll try to help.
Yeah.
But I know she's saying, you should have been coming. Like, what are
Yes.
you doing? All right.
That's the
So,
maintenance. That's not the reactive. That's making sure that, it's a consistent. So that's a consistency. And you can relate to this. So when patients come in the office and they're like, it's repetitive, and we don't get that often because we don't get that where it's this cumbersome. Why do I have to? They're seeing changes in their lives, that kind of thing. But when it does happen, I correlate it to if you decide to go on this workout program or you decide to do a weight loss program, right?
mhm.
If you lose 10 pounds and you go right back to what you've been doing before, then 10 pounds will come to find you again,
Plus
right?
more.
There you have it. And beyond that, it is a repetitive because you're changing the structure of your body when we're
Yeah.
doing your adjustments, right? So I adjust you, you go and do what you typically do in your lifestyle, and that changes that structure. So I do, you undo, I do, you undo until the body recognize this change that's happening. And that's the misalignment that we're aligning, right? So it is repetitive, but it's repetitive to an end goal, and then you maintain. Then you maintain.
Yeah. Yeah. Are there any, so even if it's common, are there any, say, common tips that you give to your patients? Because sharing what you just said, you do and they undo, you do and they undo. So are there any tips or like techniques, whether it be, like lifting or putting pressure on
Yep.
their side or whatever?
Yeah, so making sure that we're lifting with not with our back, absolutely not with our back. Most people lift and do that stretch over where they're lifting with their back.
Hmm.
And then beyond that, if I could, because everybody's at their computers right now, or you're looking at a phone or whatever, this is one of the biggest. We're getting whiplash in our office now from people, induced whiplash. And that's from text neck, right? Looking at the cell phone all the time, head down. Our computers, our cell phone should be at a 90-degree angle where we're looking directly at compared to looking face down, because then you're doing this motion on your head and your neck and it's taking all that tension, right? So just simple things like that, making sure that you are increasing your equipments to eye level, and that's text neck. There wasn't a thing before called text neck, but now we have text neck syndrome. That is a thing.
Oh, wow.
um and which can also cause whiplash. So that's one, making sure you're not lifting with your back. We should also make sure that we're stretching. I tell all my patients that they should be taking collagen.
Hmm.
Collagen is like the WD-40 for the joints. Don't come to me when it's squeaking. Take care of it now, right? Where your skin, your nail, your joints. So those are some simple things that you're taking. You want to make sure you're hydrating your system. You want to make sure you're getting rest, the natural things that help the body to heal.
All this
That's no.
talk is
Yeah,
making
that's
me
no.
thirsty.
Extra, real extra. but yes, we got to make sure
Dragons,
we
you know.
high. Yes, we got to make sure we hydrate our system. But those are some, simple principles that we can put in place. But as you say, do I would encourage everyone, and when you know better, you do better. I know better as a chiropractic physician that we should be getting adjusted. And adjustments help to boost the immune system. Adjustment help with the decrease of pain, as we just talked about, decrease of inflammation. But beyond that, because of subluxations that allow for dis-ease and allow for your chiropractor to get to the root cause of what could be causing misalignments in your body.
Yeah. There's a question in the chat.
Yes.
I can answer this question. However, it's not about me today. So, would you like to answer this question?
Wait, are deadlifts lifting with, say it again? So wait, are deadlifts lifting?
Lifting with our backs. So, like deadlifts in general is one of those exercises where it's very beneficial, but if you do it wrong, it can
Yes.
cause severe.
I I don't do deadlifts. I don't encourage my patients to do deadlifts. Deadlift have taken me out before. I'm just it. as transparent as I can be.
Mhm.
Deadlift has caused a herniation in my lumbar. You know, even as a physician, knowing the proper mechanism in how to and how I should be lifting. Sometimes we just get into a zone and you're like, yeah, I can do this. Yes, and it took me out for a while. So I don't unless you are meticulous, you know, focused on every lift. I say just do an alternative. So I don't deadlift.
Deadlifts have given me injuries. They have flared up my herniations. I have L3 and L5. Sometimes they kind of do a little dance.
Yeah.
However, deadlifts are still my favorite exercise.
They're not
It's
my
like a love hate. It's like
I
I'll
don't
take a break from them, but then it's like an ex girlfriend. That was a bad analogy. That was terrible.
that was
Sorry about that.
that was
Cancel that. Cancel that. But
that
I
was a
just
bad
keep
one.
going. But I just keep going back. I
Yeah.
just it's something about deadlifts.
So my trainer, he desires me to do it, but I will say, Sherry says, I love your staff. We love you too. So I'm just meticulous in the fact that I know what has happened. It's just not unless you're doing proper positioning, proper mechanism, making sure that you're lifting effectively. It definitely can hurt you.
Yeah, yeah. Before we go into the next segment of our show, seeing Sherry, it made me think of something. I don't know if she's watching, but if Evelyn is watching,
Hey,
see?
Miami, we're all dragons in here.
Yes,
Good stuff.
yes, yes, yes. See, yeah, form is everything. I'm telling you, deadlifts, man, deadlifts are life. But gotta be careful. Gotta.
Yeah, you have to be careful. You have to
And
be.
I see people all the time doing deadlifts. And here's my rule with deadlifts. If you have back pain, or in the past, if you've suffered from back pain, or if you're just not sure, right? Do deadlifts in a mirror and don't face the mirror.
It's
Turn
fine.
sideways so you can see what's going on because I've seen some people's back looking like a rainbow.
Where it should be flatlined.
Yeah. Like,
Yeah.
oh, but I don't feel anything. It's not the point. You might feel it later.
Yes. Yes. That you may, and that for when I got the injury, it wasn't a matter of um bad positioning. I was just lifting too quick. Right, so sometimes you just never know.
Yeah.
So as much as it is an effective workout, you just got to choose. I say choose your poison wisely, and that's not what I want.
Yeah. I haven't done deadlifts in probably 2 weeks and I'm itching to
So bad.
deadlift. So, can I, what? Can you show your shirt again? Sure. So you want to tell them about this shirt?
Absolutely. So that is Ankara Miami t-shirt, and that's by Evelyn O. And she's also the CEO of Ankara Delight. So you guys can check her out. As he was sharing with Sherry's at After Hours XX 3X or 2X. But we
I
all
think
went to
it's
Stranahan High
2X.
School. 2X? Okay. We all went to Stranahan High School. We're all dragons. It's a beautiful thing to know that we are walking in our purpose and doing our thing. But yeah, so Ankara, Miami, all things Ankara and Africa.
Yes.
As she says, celebrating the beauty of Africa.
Yes. Yes. Evelyn, hit me up. Let's chat. Let's get as much Shanahan alumni here, man. Representing. Seriously. All right. So, do you know what time it is?
What time may that be?
You don't know what time it is? Do you know what time it is?
I'm about to find out.
Color time. Color time. Woo. All right. This
Okay.
is the part of the show where I, the host, will ask my guests, I'll say a random color, and you will share what that color means to you. So
Okay.
there is no right or wrong answer. Sorry, she just threw me off with that. All right. There is no right or wrong answer. It can be logical, it can be spiritual, it can be deep, it can be vague, it can be
Okay.
one word, a story, anything that comes to mind. Are you ready?
I'm ready.
Here we go. Color number one, black.
Beauty, beautiful, powerful, strong.
Go on. All of that.
All of
Yes, yes, yes. All right. Color number. Yes, that color is coming. The color is coming.
that color's
All
coming.
right. Color number two. Let's go with red.
Red, red, fiery, rosy, red, hot,
Okay.
red.
Okay. Okay. Color number three. Let's go with brown, but like a wooden brown, like a brass brown.
Like a brass brown. Hmm. You know, I'm not sure why the first thing that came to my mind, and probably because I'm close looking at it, I have this guitar, right? Where I'm
Okay.
trying to do a thing with this guitar. So my
What thing are you
guitar,
doing?
I don't know. I don't
Bring
know.
the guitar.
Nah. So I do. I have a newly found I don't know if it's not a talent yet. It's not even a skill yet. Right? So that just first came to my mind, that guitar. That acoustic guitar. So we'll see what that skill bring about. But that's what popped to my mind when it said brown. So there's the story for the brown.
So let's make a deal, shall we?
I'll do.
Let's talk. Here we go. So, before the year is over, which is not that long, but before 2021 is over, I will be more diligent and take better care of my spine, and you will get better acquainted.
With my guitar. I
Yes.
can deal. I can deal that.
There we go.
That's a deal.
So when we bring you back on the show next year,
Is that the second part of the
you
deal?
can, yeah, you can do a little, yeah,
Okay. Okay.
yeah.
Rock with that.
You heard it here, yeah. Holding it to it. There's no
I
backing
can
out.
rock with that. I can rock with that.
All right. I'm going to steal that. Here we go. Money green, and you can't say money.
Shmoney. That don't work.
No.
Money Green, Draca. Listen, that's my money coach. So, okay, I can't say money. So I say investment, I say wealth, I say growth. Uh yes, money green. Right? That's my money coach, Draca here. I say we gotta be invest in our health, invest in our wealth, invest in our finance. Yeah, so I picked up a new skill in the last few years of learning options. She's pulling my coattail to learn futures, but one thing at a time. But yes, so that money, wealth.
I want a money coach. I don't have a money coach.
Draca Jones, she's right here. Tap in, tap
Very
in.
good.
Yes,
Let's chat. I want a
let's
money
chat.
coach.
No, that's a good conversation to have. I've definitely increased just my knowledge of how to manage money and how to invest. Sometimes we think things are not for us, don't know how to do.
Hmm.
Right. We all can invest in the stock market. And I've learned that to be true. And when you have a coach, you get leaps and bounds because now I get to skip over some of the mistakes um that others may have made. But I must be transparent. The market giveth and it taketh away. So,
Partially.
So be ready. Be ready.
It blesses abundantly,
Yes.
and it taketh away harshly.
Yes, yes. It giveth and it taketh away. But absolutely shout out to Draka. Draka is my money coach.
Hmm. I I like this name.
See, look at all my queens coming up. Rhonda, that green.
Green, man.
Yeah, so for the last year, I've been part of a group of lady called the Queen of the Capital, and Rhonda was also. So we always try and take care of our money. Not trying to, we were definitely taking care of our money in that season.
Hmm. Is she like another coach too? Is
No,
she?
Rhonda is
Mhm.
not a money coach, but she know about her money though.
Oh, okay.
She does for sure. Yes.
Rhonda Green,
Ron-
holla at me. Let's go.
Author. Yeah, she's an
Let's make
author.
money.
Yeah, she's an
Oh, she's an
author.
author.
She is an author.
Hey,
Yes.
I
Yes,
will be having a month theme for authors, so that'll be coming up soon. Okay, there we go. Yeah, you see that? I'm always like, hold on, wait a minute.
that's an idea.
Yes, financial literacy. Yes, money talk
Yes.
is a thing that is needed. That is very much so needed. All right, you're not off the hook though, so we still got more colors.
Okay.
Nice try.
More colors.
Here we go. Let's go with bone white.
Bone white, angelic purity, So here goes a shameless plug on Card Delights. The other day, she had a live and she had this majestic, beautiful caftan that was like white with just gold beaded around. So on Card Delights, shout out to my girl Evelyn O. So yes, angelic purity, that white caftan.
There it is. See? See, you know you have people who have your back when they plug your stuff
Oh yeah.
during their interview. I
Absolutely.
love that. Melanie, you gotta remind me how to say this color again because I forgot.
Woo.
So can you pronounce that?
I can't. Then you have to tell me what it looks like so I can describe it. What it means to me.
They brought this color up in a few episodes ago, and cerulean, something like that, and I forgot how to pronounce it, and I forgot what color it actually is again.
Mm.
I forgot. Can you look it up again? Google that. All right, we got two more colors. Here we
Okay.
go. Let's go with turquoise.
Turquoise, my whole body. So a product that we didn't talk about, but my whole body is my product line. You're like, ooh. So supplement. So my supplementation brand, yes. So lifestyle and supplements. So my whole body. Health is not a look; it's a lifestyle.
Mm, I like that plug. I wasn't sure, like, if you were going left, I was gonna call Sherry. Like, join the conversation.
All right. Let's stay right. Let's stay right.
Indeed, indeed, indeed. Cerulean. It's pronounced cerulean.
See, Melanie gonna have to join. If I feel like that looks like both of us. Listen, I'm hitting Google. I don't even know what that looks like.
Cerulean, and it's ocean blue.
Ocean blue. So I think tranquility, peace. By the water. Yes.
Yeah. What body of water comes to mind right now?
Ooh, Caribbean. I'm Jamaican, so take me to the Caribbean.
Yes.
Take me to
Yes.
the Caribbean.
Yeah, Florida beaches are cool, but
The Caribbean is,
yeah,
yes, yes,
yeah,
absolutely beautiful.
yes, yes. We're out of colors, but I just have to say this color because this color is so special. This color is so potent. This color you're actually wearing. This color, somebody mentioned it in the chat. So why not? Final color, purple.
Royalty, Walker Chiropractic and Wellness Center. That punch of vibrant being, in a space where you'll be treated like family. So royalty.
There it is. There it is. All right. So, thank you for fearlessly participating in Color Time. You did well. You did well. Um, Now I want to go a little bit dark. And you, during this whole 19-year journey
Hmm.
into medicine and specifically chiropractic care, um, any dark seasons, any any valleys where it's like, I don't know, Lord. So you're muted on my end. Let's see if we can check, check. So can you all hear her? Because I can't hear. Check, check, check. I can't hear. No, they can't hear. Nope. The pros of going live. All right. She'll be right back. She'll be right back indeed. Yeah, going live. So this is a great reminder for those of you watching to do me two favors. Click that like button on the episode and subscribe to the Blaze the Lion podcast.
Can you hear me now?
Yes, we can.
Yes. Okay.
I was
So,
just gonna ramble, you know what I'm
yeah,
saying?
you're
But it
gonna
was,
ramble until something happens.
you know, stay
Okay.
ready.
All right. Okay. So your question was, were there any pitfalls, any glooming times,
Hmm.
any overcast? So yes, one of the major glooming times that happened after I finished chiropractic school. When I was going to chiropractic school, my brother was in chiropractic. Well, he wasn't in chiropractic school, but he was attending uh, Bethune Cookman while I was in chiropractic school, because Port Orange and Daytona is probably less than 5 minutes away from each other.
Hmm.
And after I got through chiropractic school, finished with chiropractic school, we are going our separate ways. I came back home to kind of like figure out the way and what I was going to do with this whole degree that I have now. And shortly after, my brother passed away from a heart attack. So that was a huge unexpected for my family. Just a big, as you say, gloom that happened. We had goals and desires of him being my office manager. Probably why some of the times I'm in the office fumbling now in certain aspects. But that was a big deal for me. That was a space and time where I I I wouldn't have said that I would have an office. I had a desire for an office, but everything was just like in hindsight, I was in a space of depression. But then I started a nonprofit in his name, and I also started teaching because I just didn't want to be in the space of healthcare. I'm not sure that I could have handled that at the time. Um, yeah, so that was a down space. It took me about 3 to 4 years where I kind of deal with that process, or however that was, just dealing through that. And when I opened the office, I remember that space of thinking that he would want this to happen. So, walk forth in that should have happened. So that was um a portion there. Uh Another portion I can say, it was a I can't say it's a a valley or expectation that didn't follow through when I was going through expansion. So the growth was happening, but going through construction, and that which thought was going to be 6 months at the max kind of matriculated to about 2.5, almost 3 years.
Mm.
So while growth was happening, yeah, there was a time of woof, trying to figure out just the direction as the expansion that was happening. So those are the two things I can say throughout the span of starting to be in the field and being in the field, um, of if pitfalls.
Yeah. Um, I remember that time, and though no, I never met your brother. I just felt it, man. I felt that pain, and to see you create the foundation
Hmm.
and have events, and the name lives on,
Hmm.
and to keep going and to have that resilience, tells a lot about you. I heard a quote yesterday, and maybe you have heard this quote. I'm gonna butcher this. I should have wrote it down, but it says, um, "Some people are like tea bags. You never know how strong they are until they're put in hot water."
Mm. Okay.
So it's in that adversity. It's
Yes.
in that storm that's an opportunity for us to grow
Yeah.
and for us to learn about ourselves.
Yes. True.
And folks are always watching. So they see you pull yourself out of that. They see you turn that negative into something positive.
Mm.
That inspires them. So
Yeah, no, it definitely was. I am grateful. Like, we're grateful for the foundation, my family, our board members. We're grateful for the foundation to be able to impact the life of the youth in our community and give out scholarships. And as you talked about the events, we haven't had events in a couple of years, and we all know COVID is here. To put on a basketball tournament, that's kind of tedious right now in the aspect of what's happening.
mhm,
But for sure, you're right. You just never know that, because if I was on the outside looking in, I wouldn't have think that I would have been able to handle. And there's still difficult days, but I am grateful. I know he lived a good life. I can't say, it in my eyes, I'm like, got cut way, way too short.
right.
But I'm glad for the blessing that carry on. I have people who come to my office today who says, I know Owen. I knew your brother, so there's always a remnant. There's always a conversation. There's always a connection to him. Just the high school that we sponsor at time to do their school physicals, was his high school. That's one of the biggest reasons that I make sure I plug into that high school. So how we can see fit, one as an organization, but two as a family, to plug in to the community that he was a part of, we look to do that. Yeah.
Yes, absolutely. I see uh, Octavia Osamp says that she can also play the guitar. So, oh no.
She needs to give me lessons.
So,
I need
y'all
lessons.
may need to have a face off
I
next
taught
year.
myself how to play some years back. That's what I'm trying to do now. Teach myself.
I've always wanted to play the guitar. That's the one instrument that I've always wanted to, and I just never started. So, hmm, maybe we all, get
Do
back
a
to the
sing
guitar.
along.
Yeah. you know. Um, I want to touch on one more thing before
Okay.
we move forward, and we're gonna close pretty soon. Um, yeah, how often do you hear this? I had an injury on my L5 and S1 and had surgery, herniated disc, sciatica, which you had mentioned.
I struggle at times, but I'm a lot more mindful of my form. Yeah, so it's a continuous thing. I would encourage you, Melanie, to make sure that you're doing some Mckenzie. It's called Mckenzie Stretches. I will also encourage you that you make chiropractic a maintenance part of your lifestyle. Um, so yeah, those are two. But Mckenzie, and also definitely make sure you are hydrating. You are, collagen, as I shared before. And that form. You want to make sure that you're protecting that one body you have,
Yes.
especially with a previous injury. So what happens with a previous injury is that one, it's kind of like if you have a scrunchie. Us as young ladies, we put the in our hair and you wear it out. If it's worn out, it's just worn out. If the ear is worn out, you can patch it up, but it's still worn down. So you want to make sure that you're doing what's effectively gonna help with that wear and tear.
Mm-hmm. Indeed. So, how can people reach you if they want a consultation, if they want some treatment?
Absolutely. So, Walker Chiropractic and Wellness Center, we're located here in Miramar, Florida, and that's 8844 Miramar Parkway. Are on all social media, we're at Walker Chiro FL, and that's Walker Walker Chiro FL. We have an amazing team in our office. Dr. Brown, Dr. Amakar is also physicians in our office. You are getting the best chiropractic care when you walk through those doors. We always say the patient is our mission. We're looking to treat them like family on the day that we love our family the most, right? So that's a good care day. That's like a Thanksgiving day. That's like a Christmas day, right? So that's where we're located. That's how you can contact us. And yeah.
Is there a website?
Yes, it is www.walkerchiropracticfl.com.
How to spell this now? All right. Cairo.
Makes Shanahan look proud now.
No pressure.
So it's walkerchiropracticfl.com. And on
If you click this link and it doesn't work, blame.
I
You
Shanahan.
can blame my high school. Yeah.
But there you can schedule appointments, you can request appointments. I hear someone was talking about sciatica. We have state-of-the-art techniques and equipments in our office. We have a laser in our office that help to stimulate the system itself. We, as I shared before, Dr. Amakar, Dr. Brown is in the office, who are amazing physicians. So yeah.
Hmm. Whew. I would like to thank you so much. Thank you so much for your time, for sharing your expertise, for laughing at my corny jokes, for just being a good sport through color time and being real, being genuine. In closing, is there any quote? Is there any story? Is there any gem? Is there anything you would like to share with
Mm.
our audience?
Any story, any quote. If I was to share a quote, I might butcher this one a little bit, but the quote that shares with us that the doctor of the future will take interest in basically taking interest in you, your frame, rather than the sense of medication. So we want to make sure that we're taking interest and knowing that we're aligning ourselves to physicians who are looking to what build our system compared to what tears us down. Remember that your health is your wealth. And as this is going to be on a t shirt going forward, pain is not a lifestyle.
Oh,
Just like how you would tune up your most expensive car, tune up that $1 million product you have, your body.
yes. This is my Porsche 911.
That's
United
right. Take care
States.
of it. Take care of it. Take
Mhm.
interest in your body.
Yes. Absolutely. Thank you.
Thank
Truly,
you for
truly.
having me. Thank you for having me. It's been a pleasure. I'm grateful that we do get to walk in our purpose, get to walk in what we are designed to do, and go Dragons. Stranahan has done well.
Hey, yes, yes, indeed. In closing, do you
Yes.
have a joke?
A joke. No, I'm not good with jokes. I just laugh at them. I don't have
Ah,
jokes.
okay.
I just laugh
Uh,
at them.
Okay.
I
Good
just
answer. I can't. Yeah. I
you don't,
just.
you don't have it. I don't have
They just come. I don't like. I can't plan it out. So I was just wondering if you had like an old, I like a like a Jamaican Caribbean.
no, no,
No.
no.
Or maybe a saying that your parents used to say. She's like, "Why you put me on this spot here?"
You know what? No, but you know what? In the sense that I was talking about when I was talking about, sometimes there's this, a black chiropractic female physician does the size. I've got people who come into my office say, "Oh my God, no, she can't adjust us," right? And we're all probably the same frame in the office. So I give you this whole Jamaican saying, "We lick about with talawa."
Hey. Yes.
Right? We might have
Yes.
small frames, but we are able to adjust any size, any shape, height, no matter how it may be. As we say, we do neonate to geriatric. So in our office, we might be lickable with talawa, and we're ready for you.
Ready. I love that. I love that. Yes, yes. Thank you again, Dr. Vanessa Walker, for episode 44
44, I
of
love double digits.
of the Blaze Line podcast. Tune in next week. Next week will be our final episode under this theme for doctors, and we will have. Well, you just gotta watch and find out, right? But next week will be our final doctor, and then in November, our theme for November is vegan chefs.
Hmm.
And restaurants. So we'll be highlighting some local restaurants as well as some vegan chefs that maybe you've never been to, or maybe you've seen in different states, different cities. So we're gonna highlight food just in time for Thanksgiving, for that whole fall, nice hearty food going into that. So again, make sure you look for us on YouTube. You can watch the replay right now if you like. All right. And then tomorrow, all right, tomorrow morning, when you wake up and you rise, and for anybody who missed this and people who you want to share this with your friends or your family or your coworkers, and they ain't trying to go on YouTube and do the whole thing, no problem. The audio will be available tomorrow, all right, on Spotify, Google Podcasts, Apple Podcasts, Breaker, and a bunch of other major streaming sites and platforms. So you can plug that in on your drive to work. You can take the long way to work so you can listen, all right, and learn something and take care of your health. Because guess what? Guess what? Guess what? Guess what? Pain.
It's not a lifestyle,
Hey,
and your health is your wealth.
straight up, straight up, straight up. Thank you again. This was the Blaze the Lion podcast. As I always say, peace and love.
Good night.